we are live.
Cool.
All right, welcome to our Facebook Live Town Hall series. Today is joint session day. I'm in Washington, D.C., fresh off the red eye yesterday out of San Francisco. It was nice to be out in the community. We were in Hayward and at the Lawrence Livermore Lab, but back in Washington to hear from President Biden. And I have today with us a guest I'm going to introduce to you in a moment. But tonight at 9 o'clock Eastern, 6 o'clock Pacific, where we live, Joe Biden will address the country on his 99th day in office. And the backdrop and the setting will be a little bit different than you have probably ever seen for a presidential address. Two big ways that I just want to prepare you for. First, not many members of Congress are going to be in attendance. I am a member of the House leadership team. I will be there in attendance. But because of COVID restrictions, we will be spaced out and you will not see as many of us, but hopefully that's the last time it'll ever look like that. Second, this is the exciting part, the different scene change than what you've ever seen before. Sitting behind Joe Biden will be two women from San Francisco. You'll have Speaker of the House, Nancy Pelosi, no stranger to presidential addresses. This will be the fourth president that she will sit behind as a Speaker of the House. But also sitting next to Speaker Pelosi will be our own Bay Area's Kamala Harris Vice President, who will preside as the leader of the Senate, President of the Senate, sitting next to Speaker Pelosi. So what a scene of a woman of color, the first woman and second woman Speaker of the House, and President Biden to lead our country. My guest, and every year you know this because we always showcase to you who we bring in person to the State of the Union. Because of COVID restrictions, there will be no in-person guests. However, we will have a virtual guest, and she will be a part of a virtual guest experience that she will be a part of later tonight, is Michelle Gutierrez-Vo of Union City. Michelle is a nurse in the adult medicine clinic at Kaiser Permanente in Fremont, California. Michelle, welcome. Thank you so much for joining us, and thank you for being our guest tonight.
Oh, Congressman and everybody, good morning. Thank you so much for having me. Thank you for your leadership. We are appreciative of your leadership, President Biden's leadership, and we're certainly excited and look forward to working with you all.
Michelle, what a year you have probably experienced. And so first, thank you for everything you've done, every sacrifice you've made away from your family. But what can you tell us about going back to March 2020 and where we are today? What was it like to go through the darkest time in our lifetime as far as a health crisis in America?
First of all, as a nurse, a mother, it has been brutally terrifying, exhausting, and heartbreaking to really witness, not only at work, but with my family and the community really suffering from this novel virus. There's a marked difference. We especially are very appreciative of President Biden and the Congress's leadership in passing the America Rescue Plan that provides significant monies and much needed economic support for Americans, funding for state and local governments, for the COVID vaccination and COVID-19 tests, which really is the key, one of the key in really stopping this pandemic. We are such at a critical point. The other thing is we welcome the administration pressing forward the OSHA emergency temporary standards that we have been urging since the beginning of pandemic as nurses. As you know, the pandemic is far from over, and we have been tracking literally the deaths of nurses and healthcare workers. As of last week, we have 3,758 healthcare workers, including 387 nurses who have died from COVID-19. And that is because, as we all know, a big part of the transmission of the COVID-19 virus is asymptomatic transmission. So therefore, it is critical that this emergency temporary standards be swiftly reviewed by the president and issued as soon as possible, because lives are really in the balance. And when there is no infection control in healthcare, in our workplace, and in essential workers, working environments, the community is literally in grave danger. So that is a critical point for us. We are once again very, very appreciative. And I have to tell you how grateful and refreshing it is to be working with an administration that relies on science and evidence-based, really scientific data. That is important for us as nurses.
Michelle, how would you describe the difference between January 19, the day before Joe Biden was inaugurated, and the year before, and what happened afterwards? And I don't care about your politics, and I know when you go to work, you don't think about politics, you just do your job. And we know this virus doesn't care about politics, but can you just contrast for us, if you saw one, just the difference on the front lines?
Literally, I can tell you, it's a breath of a sigh of relief with seeing the expansion of access and eligibility of the community in attaining the COVID vaccine. That is first and foremost comforting to the community, and especially to us as nurses and healthcare providers. When you have a community panicking and pressed against time in trying to, save their lives, right? And you have an administration for the first time since this pandemic started, who really is listening, who is in the pulse of the people and what we need. That is comforting. And you can literally, me as a nurse, I can literally see the tension, drop from my patients, from the community, and really just, seeing more normalcy returning. And it was swift. That is a marked significant difference from my eyes as a nurse and as a community member.
Now, what about your colleagues? Can you just talk about the morale? Now that people have been vaccinated, is there a light at the end of the tunnel? Or is it still anxious times on the front lines?
I think there is a sense of relief, but I think, the pandemic is far from over, as evidenced by what's happening in Michigan. It's raging over there, and we still, even though we have COVID vaccinations, which they need to continue, and the access and the supply need to be, continuation as far as the supplies and appointments and things like that. But once again, workers' protection, really a competent and compassionate administration to really see what the people need, and to really look ahead and prepare and plan ahead to make sure that, we have a leadership that is proactive and not reactive. That is important for us, especially as nurses. And once again, this OSHA, emergency temporary standard, that is our lifeline. As a nurse, I have 3 kids. When nurses do not have the proper protocol, and not so much adequate, but appropriate, temporary standards, emergency temporary standards, especially with this COVID virus, which should really be acknowledged as transmissible by aerosol.
Yep.
That is very critical, and that ETS needs to include that as a requirement so that it's enforceable by employers. That is our lifeline. That without that, nurses are going into work unprotected, and we are bringing it home to our families, and we are bringing it home to our communities. And you don't sleep good at night living like that.
Now, you've mentioned the rescue plan and that $1.9 trillion stimulus plan. It funded shots in the arms of Americans, money in the pockets of people who are unemployed, for businesses that had suffered through the pandemic, direct payments to families, grants for restaurants, grants for live venue operators. Really the array of people and entities affected by COVID. Have you seen the benefits of it in our community since it was passed a couple months back?
Absolutely. As a nurse, especially as a nurse in adult family medicine, I mean, we hear the cries of community members losing their jobs, not having enough money for, to stay home to take care of their kids, or not being able to stay home even when they're sick because they have no money, or really losing their jobs and not having enough money to pay bills, to forego medication that is life-saving for them. Those are all critical. And this American Rescue Plan really did infuse that breath of life to the community that we have really been waiting for. And when you see that, and when you see that patients are able to take care of themselves, prevention is key in medicine. And that did that for millions of our patients. And that is also less stress for the healthcare community, because we feel we're effective and we're able to really, really, help the patient holistically.
Michelle, we talked about the vaccinations, and obviously you're seeing people. You said everyone in your house is, you told me everyone in your house is vaccinated. Mm-hmm. What would you say to someone who has a concern about getting vaccinated, just based on the science and based on how it's, changed your way of life?
To be brutally honest, I started being skeptical, especially as a nurse.
Yeah.
And I waited a little bit, and when I started really thinking about it and weighing the risk benefits and really seeing in 1 year how many lives that could have been prevented, deaths, I should say, that could have been prevented, because of this COVID vaccination. I will say, get vaccinated. It is worth it. I mean, the side effects, yeah, we have, there are people who have bad side effects, but that comes and goes. And the effects of COVID-19 on the body, there's documented evidence that it can be, really long-term. And as a nurse, I can tell you, I have patients who still are not able to walk up and down the stairs. And these patients are, they used to be marathon runners, very active, zero comorbidities, and they still, have those post effects of COVID. So please get vaccinated. It will save your life. It will bring our community closer to really ending this pandemic. When you stop having hosts to the virus, then that gets us closer to our goal.
Michelle, I'm so glad you mentioned that in your story. I think is really inspiring, and I understand why you had concerns. And look, I think it's interesting for our country that we still have the worst death rate per capita. More people have died per capita than any other country, because I think we made a lot of mistakes on how we initially approached the virus, and how reckless we were in many ways in congregating. But we also are the country, that was a part of the effort with some other countries to discover the vaccine, and we are way ahead in distributing the vaccine. So I don't know what it says about us that we had the highest death rate, but we have the fastest distribution rate. It says a lot about our ingenuity, but I understand that people have questions. And what I have found is that when people have questions, the worst thing you could do is to try and shame them or mock them or lecture them about getting the vaccine. And the best thing you can do for anyone listening is to listen to them and ask them what their questions are, to talk about, as you just said, the cost benefit analysis. And if you can, direct them to a professional. They don't need to hear, from an athlete or a celebrity or, a politician telling them to take it. that may help. But I actually think that our healthcare professionals are who they want to listen to. And for everyone here, we will put in the chat, cdc.gov has, from healthcare professionals, a number of different, Q&As around the vaccine that you may have yourself, and it answers it. So thank you, Michelle, for sharing that, because I think your concerns are everyone's concerns. And I think your cost benefit analysis is the correct one. And we would hate for anyone to get this virus and then have 10-year, 20-year effects. So Michelle, I wish you could be with me in person tonight. You're going to be virtually attending this. Now that we've passed the rescue plan, over 50% of Americans have received at least their first vaccination. What do you hope to hear from President Biden tonight?
I'm hoping to hear more of that. I'm hoping to, that he's going to mention something about, a really more solidified plan moving forward in terms of vaccination, relief for the American people, protection for workers, especially healthcare workers. Those are the things that, I'm really looking forward to as a nurse and a community member.
That's great. Well, I hope he talks about that. I also hope he talks about ending gun violence. As a nurse, you're on, the front lines, and you see, and we've seen in our community, an uptick in violence. And I really hope that we do all we can to take the most dangerous guns out of the hands, of the most dangerous people. Michelle, what is just, here we are, as I said, we're approaching June 15. The governor has told us that that's the day that everything's going to essentially go back to normal. We'll still mask indoors, but we can congregate again. Outdoors, we'll be able to take our masks off. But hopefully this is a summer of renaissance for us in the Bay Area. But what advice would you have to our residents just for their own health and safety, as we go into this summer? What can people do to just protect themselves from this virus and just stay healthy in general?
First of all, get your COVID vaccine. Number one, first and foremost. Secondly, mask. Please continue to wear masks. For the first time in decades, our flu season was inexistent. And, I have to tell you that I've been a nurse for 24 years, and I could not believe we did not have any flu cases or pneumonia cases. It was all COVID. And that tells us that if we knew, that every flu season, all we had to do was mask, socially distance, stay at home if you're sick, stay away from sick people, sanitize and hand wash, we would have saved millions and millions of lives in these past decades. So please, it doesn't take a lot of energy to put on your mask, hand wash. This pandemic is far from over. We were, a little bit in this stage last year. And this is, I think, a critical point for us. If we want to have a healthy fall and winter season, we need to really mask, get vaccinated, and continue to have precautions.
That's great advice. And I know that the plural of anecdote is not data, but a personal anecdote is, it was really nice to go a year with a 3-year-old and a 2-year-old without catching a cold and without catching a cold and without, getting the flu. But I can tell that we're all getting a little bit, looser on our masking, because my 3-year-old and 2-year-old have brought colds home in the last week, from their preschools to our home. So I think those days may be coming back, but that might be something, the one thing we want to take away from this pandemic is to just have better, personal hygiene during flu and cold season, because it was sure nice, to be healthy for the first time in a long time. So Michelle, I've got 2 questions from our Facebook Live followers. I think they relate to issues I'm working on. The first, Sarah asks, will there be another relief bill? Sarah, we are working on it. Yesterday, I visited the Stack Center in Hayward at Tennyson and Roos, and the goal is to fund that youth center and fund a number of other community projects through what's called member-directed spending. We're bringing back the ability to direct funding into the community to the projects that need it the most, nonprofit projects, not a for-profit project. So we're hoping that we can continue to stimulate the local economy, invest in infrastructure, get Valley Link funded, and that's one of our top priorities in member-directed spending, is that project that goes from Dublin Pleasanton out and over the Altamont to Stockton. So yes, we're going to continue to provide local stimulus. Another question from Michael is whether mass vaccination sites are still open. The Coliseum site is open. I believe the Alameda County Fairgrounds site is open, and I'll have our staff check and put in the chat right now if that is the case. And then Cody Tahoe Hound asks, Michelle, this one's for you. New variants continue to appear. How many are out there? And Michelle, if you don't know the science, I don't want to make you speculate, but what's your experience with the new variants, and are you seeing people who are vaccinated where you have a 90% protection against transmission and a 90% protection against a severe response? Are you seeing people come in who have been vaccinated getting sick from covariants, or is it the unvaccinated being affected by covariants?
Well, I'm not, I don't really know the specific data regarding the variants, but I can tell you as a nurse that we are seeing reinfections, even for people, from people who got vaccinated and the ones that got vaccinated earlier on. So we are seeing reinfections. And once again, these variants, they talk about this specific community. They talk about, variant A, B, C, D. Really, the most important thing, once again, please get your COVID vaccine, mask, social distance,
Yep.
hand washing, stay home when you're sick. I'm going to say that over and over again.
And when you're outside, if you are fully vaccinated and you're not in a group, you can take off your mask. And I think that is encouraging, because that shows it's a community reward for the progress we have made. We're not done yet. I think all of us would love to go to a New Year's Eve party with 50 people maskless indoors at the end of the year. And the only way we would be able to do that and follow CDC guidelines would be if we can get 70+% of the country vaccinated. So let's do our part. And as I said, the best thing you can do if you know somebody who is not yet vaccinated and has questions is to just listen to them, try and put them in front of the science, be patient with them, don't be frustrated with them. Every person has their own way of approaching this decision, but hopefully we can all be a part of getting people vaccinated so that we all can, get back to, being socially together. So Michelle, I can't wait to see you tonight on the virtual guest list. Thank you so much for doing this. Thank you so much for what you do in our community. Thank you to the California Nurses Association who told us about you. I'm just so grateful for all of the nurses in our community who have gotten us through this dark, dark time. There are better days ahead. And Michelle, you've given us kind of a path forward for how to get there. So thank you so much. And I will see you tonight.
Thank you so much, Congressman. Thank you for your leadership.
Thank you.